I like this one, it's prettier, I think. So they want to be in the yellow or green range, not down towards the red range. I like how this one is better because the yellow and green are connected and the red and yellow are connected, so in the middle it's yellow and above it's green and below it's red, so that that one isn't nearly as defined as this one, that if it's in between these, it definitely is in the yellow. That one, it's kind of like, where's the yellow? So, the methylcholine challenge is, it checks the reactivity of the lungs to see if it, so this would actually test more to see if it was an allergen causing it. And so if they inhale this, and I don't think any MAs do this test, isn't it like right with the PFT lab?
Yeah.
Okay, this kills me. In our book, it calls spirometry PFT, and I know what a real PFT lab is, and it just kills me to call a spirometry. It's one pulmonary function test. It is not a PFT.
Yeah.
Because PFT is far more extensive than this one test. But so they would have a patient breathe in. I think it's only one, and then they test spirometry and stuff, test the reaction of it. Kind of like the before and after bronchodilator, before and after the methylcholine. The FeNO test is fractional exhaled nitrous oxide, and this checks for the how do you say it again? Here I am being recorded, right?
Eosinophils.
Eosinophilic. So, which is?
Or eosinophils, is really what it is.
Eosinophils? So, it checks for, that's one of the white blood cells, and somehow that gets, and I don't know all the pathology of it, but it causes reaction in the lungs, and causes an asthma. This is more the adult onset. So, this one is similar to the methylcholine test, where they breathe it in and check to see, and somehow with their reading of what you exhale, they can tell what it is, which is far beyond my knowledge base. Okay, but it's one of the tests that patients could be sent to the pulmonologist or the PFT lab to check. Triggers. So, we all know a lot of these triggers. Pollens. Oh, you know what? It's not doing that fancy stuff because I don't have it on. There. Now I'm going to get fancy. There. Okay, so pollens, molds, pets, dander from pets. So, we just had a dog at school the other day when instructors brought their dog in, and it's a hair dog, and so I'm probably not allergic to the hair dog like I am to the fur dogs. So there are different things that bother different people, and so thankfully we don't have a lot of cockroaches in this neighborhood. My daughter lives in Texas, and there are cockroaches in Texas. Great big ones, but the little ones are the ones that are gross. Well, the big ones are ugly, but they're outside ones, and they're not, I mean, they're like this big, but they're not the ones that are in your food and stuff. They're tree ones. They're just hanging around outside. Sometimes they'll get in the house. But it's those little ones that are in all your food and everything. Those are the problem. Did you know having a cat in the house decreases cockroaches in the house? I'm not sure why, but that's true. Anyway, so dust mites, mice, if you have mice in your house, which hopefully we don't, but it happens.
A cat can decrease that too.
You can decrease that too? Yeah, we had a mouse hiding in the stove drawer, and there were holes go into the basement for like the gas pipes and stuff for the stove. And somehow a mouse got into that drawer and was living in that drawer and we could never catch it. Cat finally caught it. That was a sweet night when the cat did that. So, smoke, changing weather, air pollution, chemicals, and perfumes and stuff. Are you impressed, Jeff?
Yeah, it's good.
So, other things that can do it is nasal allergies can also trigger your asthma and sinus infections. The flu can. Viral infections, including the common cold. See, I had to get fancy because like I said, I just taught this. So the best thing to do is to wash your hands a lot if you're asthmatic and not get exposed to all those things. In other words, don't have kids. And some medications do it. So some people are sensitive to aspirin and ibuprofen and stuff, so you have to be careful of that. And you know, and most people don't think of those, so that's where it's our job to help discover that stuff. And then there are other things like GERD, sleep apnea, being overweight, and depression. It's interesting that depression can trigger it too, but there are lots of triggers. So, this has changed a bit since I worked as a respiratory therapist, because it's been a few years. But inhaled steroids. Way back, before dirt back then, way back, they didn't have inhaled steroids. They would give like oral or shots, and it would affect your entire body. And then they came up with the nebulizer. So I worked with a doctor who was trying out nebulizing triamcinolone, and we had to give that in the hospital to kids. And so we would use an actual nebulizer, which, you know, no, Jeff probably doesn't know what I'm talking about, nebulizer. So, so we would actually use a needle, draw it out of the bottle, put it in the nebulizer with Eluvent, and nebulize it for the kids. And his theory was these kids, almost all asthmatic kids, also have eczema, and it was not affecting their eczema, so it wasn't going systemically. So it was safer to give it where it was more topical to the lungs than it was systemic, because the side effects were less. There are still side effects to steroids, even inhaled ones, but so you can hook this up to either an air compressor, or in the hospital we often used just oxygen, except for our chronic lungers, didn't get oxygen, but we'd hook it up, and it's Bernoulli's principle that the negative of going across the tube draws it up and aerosolizes it and gives you a nebulizer treatment. And so to really aid myself, I started out with Bronchosol, which I don't even think they use Bronchosol at all anymore. That was the drug we used all the time, and Mucomist for, do they still use Mucomist?
I've heard of it.
Not for asthma, but for,
I've heard of it, but
it
I think
smells
maybe
like rotten eggs.
COPD.
Yeah, COPD, it helps to,
For the phlegm and stuff too.
yeah, it,
It's like Mucinex.
yes,
Yeah.
it's like Mucinex. It thins out the mucus, and so you can cough it out easier. It really stunk though. It smells like rotten eggs. And another cool fact about Mucomist, it's the same thing they give to someone who overdoses on Tylenol because it neutralizes the Tylenol. They have to drink the stuff, and it's horrid. It's usually suicide attempts, and they have to either that or the NG tube to get it in, but it will neutralize because Tylenol will destroy your liver. So, anyway, we used to give these every 4 hours in the hospital, wake people up a lot of times for them. So, back to steroids. What are some of the side effects of steroids?
Increased heart rate.
Increased heart rate. Long term. What's a long term? You get that moon phase, decreases bone marrow, decreases immunity, weight gain. So now some people have to be on steroids always. Rheumatoid arthritis is one they're on a lot of steroids. Lupus. But there are side effects, so you always have to play that balancing game between the side effects and the benefit. So doing them in you know, the squirt thing. Inhaler. I know what it is. Just plain. Okay, so using steroids in an inhaler or in a nebulizer decreases those systemic effects because it acts like a topical. So if you use a steroid on, say you have a rash, you put steroid cream on, it's topical.
Betamethasone.
Yeah, it's right there, isn't it? Betamethasone. Triamcinolone, that's the one. Anyway, cromolyn and cromolyn sodium, that was the first one. That's a powder, and it used to be a really difficult one to take. Is it still that difficult? It used to be a really difficult powder, and you would always cough and choke on it when you took it. But it was one of the, at the time, it was the best treatment for it. Now they have so many other
As I
inhalers.
said, I've never heard of cromolyn in 4 years.
In 4 years, yeah, that's, it used to be, well, that was the first one that was a long-term use that wasn't a bronchodilator. Then there's some you can take as tablets, and so beta-2, I always think of it this way, I really oversimplify it, but beta-1, beta-2 stimulants, beta-1 is heart, beta-2 is lungs, there's 2 lungs, so beta-1, but most of the bronchodilators are beta-1, beta-2, so they do stimulate the heart, increase heart rate, and relax the bronchioles. So they're getting better and better, so they're not quite as bad. Bronchosol, that was a big thing. We had to always be taking their pulse before, during, and after every treatment to see how it was affecting them, and making sure they didn't go up too high during a treatment, because we'd have to quit it if they did. So that's something to be aware of with heart conditions, is that bronchodilators a lot of time will also stimulate the heart. Advair is a combination corticosteroid and a beta-2 bronchodilator, and that comes in a cute little dispenser like this, and this is a powder that they inhale. They still use these, right?
They do.
What?
A lot of them are in little puffers now. You can get Advair in like a little...
Oh, you can, in an inhaler? So this one, you open it up and you charge it, which like breaks whatever in there, and then you inhale right here, and it's a powder.
And if you tip it on its side, the powder falls out. We took one apart when they first came out. I worked for a pulmonologist then. They brought us samples and we took one apart, and if you poke the little pouch in there and tip it slightly, all the powder falls out.
All of it does.
So you have to hold it completely flat. That's why they came out with that little handy gizmo to practice with.
Yeah, so this is just a practice one.
Yeah.
So, you reset it, charge it, puff, 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 puff. So, thought that was an interesting one. I don't have an inhaler with me because I'm getting all this from the school and I didn't have any. I thought we had some practice ones. I mean, not that we would actually practice, but some demonstration ones. But so, here's another fun little tip. You know how inhalers now you can buy spacers for them? this is what we always recommended to patients to do for inhalers. I am not kidding you, they did not sell spacers back then, and they work. And see, the problem with an inhaler is you do that puff, and if it hits like the top of the roof of your mouth or
At the
your
back of your
back of
throat.
your throat, it sticks there, it's not in your lungs. But if you can do it through here, it spreads it out so that's not doing such a,
And you tend to take a more effective breath through
When your
it
mouth
too.
is open.
Yeah.
right. So this is what we recommended to everybody.
Do you have a spacer in there?
No, I don't, the school
We should have
doesn't,
talked before this.
I should have, I'm sorry. So, spacers are pretty nice though. We should Google one for you.
It has a little
Oh, he
tube
might
with
have
a hole just the exact size of most mouth pieces, and you can put it in, you spray it, and then you breathe through the other end.
Yeah,
Totally comes apart
Kids
for
too,
two.
right? Kids
or
is
it's
more
better for
useful.
kids.
Yeah.
Yeah, because you
But
don't
they
have
have-
to, yeah.
They have like little masks now that it all fits on for little kids. My grandson's asthmatic, and we found out when he was 2. And you'd be like wrestling. Child abuse.
Right, because you have to get it
And you
in,
have to do
so,
it, yeah.
yeah.
For educational purposes only?
The one we have in grade 6.
It's a basic chamber.
So it's a chain, yeah. They're so much nicer, but seriously, when
Can't really
those,
open it, so I'll just pass it around.
those inhalers came out, they, this was the best we could come up with because no company had done it. Boy,
I don't know why they just don't make them so they have to be administered
Yeah.
to it, because a lot of people just throw the spacer in a drawer and leave it.
and they're not as effective without the spacer.
Ever.
And, you know, the thing is that you can carry an inhaler in your pocket or in your purse really easily, and that spacer takes up, you don't walk around with the spacer in your pocket, but
Most of the
But that's
maintenance
handy.
ones you're not carrying in your purse, you have at home. You carry
your,
in the
your
rescue.
maintenance ones, your rescue,
I mean,
so-
we don't even like to call them rescue anymore.
what do you call them now?
Albuterol.
That's pretty funny. No, I was, so this is a quick relief or rescue, and albuterol. When, I'll never forget, I was working, and the doctor called and said, I want an albuterol neb, and I'm like, albuterol only comes in inhalers. No, right now, they just now we got them. You can give that. Like, wish the department would tell us these things
Yeah.
before a doctor has to tell us that the pharmacy has it. And one night I was working a night shift, and I had a doctor, so the Atrovent is like an atropine, cousin of atropine. Well, atropine is a really good beta 1, beta 2. And I had this doctor who was trying to get me to give an atropine neb, and we never gave atropine nebs because they were pretty beta 1 too. So we tried to avoid giving the atropine nebs, but this doctor was just insistent on it, and it wasn't approved use of atropine to nebulize it. So middle of the night, I had to call our medical director, wake him up and say, can I give an atropine neb? He said, oh yeah, we used to do that all the time. But it usually is somebody who isn't up to speed on everything, because that was an old drug, not the newer drug. And so I ended up giving atropine nebs that night, but and back to
Totally within your scope of practice.
totally within my
Totally.
scope of practice. You know, and I worked alone on the night shift, and so it was always hard because I had to make decisions, and I don't trust these doctors I don't know, and I had to work with them all the time and have them telling me what to do, and I'm like, the fun part was the neurosurgeons. I got to boss them around on the ventilators. But anyway, we had a patient one time, and I had no idea that her allergist wasn't using Alupent at the time. And she's in intensive care in severe asthmatic state. Severe. I mean, we can hardly keep this girl breathing. She's like 17 years old. And her allergies were so bad that during bad season, like pollen season, she could only eat chicken and rice. That was all, and salt on it, no other seasonings because she was so allergic to everything. But the doctor hadn't, the allergist had not heard of Elupent yet. And as soon as we say, why don't you try Elupent, change that girl's life because she could finally breathe. And he just hadn't heard of it. He wasn't a pulmonologist. He was trying to work on her allergies and approaching it from a different direction. Elupent's a wonderful drug. They still do use Elupent, right?
I don't know.
I think they do. And nebulizers? Actually have some here. Oh, this is albuterol. I thought I had some Elupent in here, but Elupent was the drug of choice back in the day. Yeah, I have albuterol in college. Okay, so 4 purposes of treatment, or 4 components of treatment. Measure lung function, that would be the peak flow, and use this to assess the severity of the asthma at the time and to monitor. So you want them to do this at home all the time. We use it in the office to compare before and after. So another component is use of medication therapy designed to reverse and prevent attacks, which is that long-term, more the steroid inhaler stuff. So we want to keep the airways from becoming inflamed and keep them free flowing, because when they're tight, you can't breathe. Environmental control. Keep the triggers out of their lives if you can. Use air purifiers in the home. Do things that can keep them from being exposed to triggers. If it's food allergies that triggers it, stay away from those foods, you know. Kids are the hard one because they don't always know what they can and can't have, and sometimes there's something in their food. They're over to someone's house for dinner, and unless you have a list. So I have a good friend who is has nut allergies, and another one who has sulfate allergies. And so I had them both for dinner at the same time, and I laid everything out, every recipe, and so I had bacon, I had the label from the bacon, I had everything laid out so that they could feel safe eating at my house. And they both went through all the stuff to make sure. But not everybody is aware of those kind of allergies. If someone says, oh, I'm allergic to this or that, people aren't aware that that's hidden in foods that they don't realize. And so be really careful. Things that can trigger the asthma. So your best friend has a cat, and that cat's going to trigger your asthma. Don't go to her house, or you take something ahead of time to stop it. And patient education is a key one for us as medical assistants. We really need to educate the patients on how to take care of themselves and how to prevent exacerbations, and work with family members too.